Do you wish you could turn back the clock on aging? Anti-Factor Lipids is the breakthrough supplement that's scientifically proven to repair and renew your body's cells. Anti-Factor Lipids are identical to the phospholipids found in your cellular membranes. They've been shown to repair mitochondrial damage, a primary cause of biological aging. Anti-Factor has also been shown to reduce fatigue by more than 40%. And it's even been shown to significantly reduce a wide range of symptoms and improve the quality of life in patients with various conditions like chronic fatigue and those undergoing chemotherapy. I've been using Anti-Factor for years. I don't go a day without it. Anti-Factor Lipids comes in an easy-to-use powder in 2 convenient sizes. For more information and to order, just call 800-982-9158, 800-982-9158, or go to ntfactor.com. That's ntfactor.com for Anti-Factor Lipids powder. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Our guest, Dr. Paul Kolodziej. He's written a great book called The Continuous Glucose Monitor Revolution for Non-Diabetics, and you can get a hold of a copy by going to metabolicmds.com/free book. It's a great offer especially for our intelligent medicine listeners, to become acquainted with this technology, which I think is extremely empowering. And, I really suggest not just for diabetics, not just for people who are concerned about whether they have metabolic syndrome, but I think it's just a great thing for people to undertake who even are healthy and have optimal metabolism, because it'll really provide you with insights into what various variables are doing to your blood sugar. And, for example, if you occasionally have, maybe you decide to have oatmeal for breakfast, like I do from time to time, although I'm mostly on a low-carb diet, is that affecting you? How well do you have a good capacity for handling carbohydrates, or are very, very intolerant of them? You can find out by using such a device. And you don't have to stick your fingers and, undergo that messy process. It'll read the numbers for you. So Dr. Kolodziej, one concern about these devices is about accuracy, because they're not drawing blood. They simply use a tiny pin that sits, a millimeter under the surface of your skin, and they monitor what's called the intracellular space. But there has been some concern that, maybe they underread blood sugar, that they're not deadly accurate. Do they have to be validated with initially with a finger stick? Some of my patients have been told that they need to do some finger sticks to calibrate the machine. Is that still the case, or has the technology improved?
Yeah, the technology has improved. Those are the older devices that needed to be calibrated. They're generally accurate to about 7 to 8%. Now, you got to realize that finger sticks are only accurate to that degree as well. Mm-hmm. So really, they're as good as finger sticks. So what I find from a pragmatic level with my patients is when you put a device on, it actually takes that sensor a little bit of time to settle into that subcutaneous environment, that environment under the skin. And so we'll have a tendency to see some lower readings in the first 24 hours or so. But then, but then the sensor gets familiar with that environment, and after that, the readings are fairly accurate.
Okay. From what I understand, I was, kind of a tech bro myself, and a fan of technology and of devices. And I use an Apple Watch, and I was looking at a YouTube video that tries to prognosticate about, the upcoming iteration of the Apple Watch, the Apple Watch 10 it's going to be, or the Apple Watch X, the Roman numeral. And that is said to be coming out in fall of 2024. And they predict that there's no guarantee, because you never know. This is all, guesswork. But they predict that the Apple Watch will have the capability to monitor blood glucose, like a CGM. Have you heard about that? And do you think it's going to be as accurate? Because it's not going to, they can't make an Apple Watch that's going to have a little pin that sticks under your skin. It's got to do it through a different technology through, I don't know, looking through your skin and looking at the capillaries under the skin.
Yeah, so the two technologies that have been used to try to develop skin sensors are, photoelectric technology to determine blood glucose, and then a radio frequency approach, the RFIDs that like are in your credit card and which you can really just use to pay for things. There's been discussion in this, quite honestly, Ron, for a number of years. I actually am a little bit skeptical that we'll see it this fall. I do think it's going to be coming at some point, and I think it'll be great. If it's not used for people that are dosing their insulin, then I think it'll give a lot of people insight into how the foods they eat affects them. And I think that's a really good thing.
Yeah, it sounds like if it comes to pass, it's going to be the killer app, which will enable tens of millions of people who wear these relatively inexpensive devices to continuously monitor their blood sugar. I agree with you. It's kind of a technological challenge to get this to work, because even sometimes I'm a little skeptical about the ability of my Apple Watch to read my pulse certain times, because sometimes it picks it up and sometimes it doesn't accurately. Okay, yeah. So so one of the things that we wanted to talk about, which has become an interest of yours, is, let's face it, we're in the midst of a drug revolution, because the GLP-1 drugs and now combo drugs, GLP-1 and GIP-1 combo drugs like Mounjaro, and eventually triple action drugs, they're going to continue to enter the marketplace and enable Americans to lose scads and scads of weight through pharmaceutical means. So you have some thoughts on that. And, first of all, the sustainability of that for most people. And also, what are some of the ways in which people can work with these drugs to optimize their effectiveness and maybe ultimately enable them to wean off?
Absolutely. So, Stephen Covey wrote a book, his 7 Habits, and one of those habits was begin with the end in mind. And the end in mind for somebody that begins to take these drugs should be, how am I going to get off these medications? And when a patient comes into my office and they're interested in losing weight or improving their metabolic health, I think, quite honestly, first do no harm. And a harm can be starting a medicine on a patient that they're committed to for life. So why is that a potential issue that they'll have trouble getting off these medications? Well, one reason is that when you stop these medications, weight regain has been identified as a significant problem. Up to 70% of the weight that is lost while on these medications can be regained. Another issue that we alluded to in the last podcast was muscle mass. People lose muscle mass when they're on these medications as well. And again, that's why I'm an advocate for strength training. So I think these medications have their place, but only in the setting of a comprehensive program where there is a plan to use them, I believe, for limited periods of time in limited amounts while you're doing other lifestyle things that will sustain the weight loss subsequent to the time that you come off the medications.
Is there a danger that because these medications so thoroughly suppress appetite that some people will just say, oh, I'm going to skip lunch today. I think I'll just have some soda crackers, and what they're getting is basically a small volume of food, very low calorie food, but very poor in the way of nutritional quality, lacking the vitamins, the fiber, the essential fatty acids, and especially the protein that are really necessary for sustaining health.
Yeah, and that's why I'm always pushing protein with my patients that are on this. Again, it goes along with strength training, trying to maintain muscle mass, but you need to target a given amount of protein when you're on these medications and make sure you're getting it. And that danger certainly exists. I have patients that forget about eating sometimes on these medications, on the low doses that I'm putting them on. And so, there needs to be a diligent effort between a clinician, like our practice, with health coaching support, so that, the entire program is being monitored. I'm a little concerned that, people are going out to the internet and getting these medications. And I think I mentioned before we got on, it's kind of the Wild West out there. And in terms of, just obtaining these medications, and it shouldn't be taken lightly. And also the medications have, contraindications, reasons you can't be on them, and also significant side effects, as well, and some complications as well. So, they should be used prudently. And, they're only really, 7-10 years old. And so really we don't know the effects of the long-term use of them. Are they good medicines? Yes, I think they're good medicines, but I think they need to be used appropriately. And in my mind, again, that's low doses for limited periods of time.
And I too am concerned about the proliferation of websites and apps that enable people to easily access a prescription without, these are often supervised by, quote, health practitioners who'll take, you fill out a brief survey and they'll, appear on a, quick Zoom conference with you and then approve you for the medication and prescribe the medication. But I just don't think that is a substitute for supervised care. I also noticed the other day, I was walking around Midtown and I saw a billboard for Weight Watchers. Now, Weight Watchers, is existentially threatened by these medications. If they hadn't adapted as they did, they might tank. And that's a big company. So what the what the billboard said is they will provide you with a GLP-1 compatible weight loss program. In other words, they'll provide diet advice, probably behavioral advice. There's no reason not to go to Weight Watchers anymore because these medications have been introduced. And of course, Oprah Winfrey herself has fessed up and said, yeah, I've lost scads of weight because I'm taking one of these drugs. I'm not saying that you don't need to go to Weight Watchers anymore, but these drugs are a reality.
Yeah. And so there is definitely, a lot of marketing going on to these. I don't know if you heard last week, there was discussion of even the company that makes one of these medications, Eli Lilly, going directly to patients and providing this medication. Well, think about that motivation. I mean,
that would be
Mounjaro.
That would be Mounjaro, right? Because
that would be Mounjaro. The weight loss equivalent is Zepbound. The same medication.
I've seen ads for that.
Yeah. So, you got to think about the motivation. I mean, pharmaceutical companies are interested in selling medications, and there are going to be medical providers involved. But I really feel the best approach is with, a knowledgeable provider, preferably has a background in metabolic health or preventive health. And somebody that has your best interests in mind in terms, again, using these medications prudently and not committing you to a lifetime of dependency on them.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you.
Have you ever heard someone say that probiotics didn't work for them? Since all probiotics are not the same, the probiotic you choose can make the difference between superior results and no results. Look for an enriched formula containing these 3 key components for best results: probiotics, prebiotics, and postbiotics. A worldwide leader in microbiome health for over 40 years, Dr. Ohhira's Probiotics is an enriched full-spectrum probiotic system fermenting multiple strains of probiotic bacteria and nourishing prebiotics. The result? Transformative postbiotic metabolites that maintain and support the biodiversity of flora in your gut for optimal digestion, gut-brain, and immune health. Dr. Ohhira's, certified vegetarian, free of gluten, allergens, dairy, and GMOs. For a superior probiotic formula, get Dr. Ohhira's probiotics today at Sprouts, Natural Grocers, and other natural health retailers nationwide.
Thanks for listening. Thanks for supporting our sponsors. They are what make Intelligent Medicine continuing free resource to you. And now back to today's guest, Dr. Paul Kolodzik. Well, so how workable is that proposition? Because you're a metabolic physician. You are founder and CEO of metabolicmds.com. And so you have patients under your care who've taken these medications. Have you been able to wean any of them successfully off the medications, and have they not gained all the weight back?
Yeah, we have lots of patients we weaned off the medication. So, we never do these programs or the medication without, again, I'm an advocate of a low-carb diet approach, often using continuous glucose monitors to guide that low-carb diet, some intermittent fasting. So we do the lifestyle things while people are on the medication. And then the strength training, again, huge component here because of the issue of muscle mass loss when you're on these medications. And then I titrate up to limited doses, like the highest dose, for example, of the Wegovy goes up to 2.5 milligrams. I seldom use
That's
over
an oral medication, right?
1.8.
Wegovy.
Excuse me?
Wegovy is an oral medication, is it not?
No, it's an injectable as well.
Oh, okay.
These are all once weekly injectable medications.
Okay.
Yeah. Wegovy is the equivalent of Ozempic.
Okay.
Ozempic is, for diabetics, it's the same medicine Wegovy for weight loss.
They just obtained an indication for weight loss. In other words, there's just a...
say, and the equivalent is Mounjaro for diabetics and Zepbound for weight loss.
Mm-hmm.
But again, I try and maintain moderate doses to get the job done, and then we titrate down in terms of a period of months, not a period of years.
Is it fair to say...
And the cost issue,
Cost is an issue, absolutely. And give me some ideas about the cost. What are some of these medications costing? Even when you put patients on this low-dose maintenance, how costly is it?
Yeah. So insurance coverage is limited. So if you're diabetic, generally Mounjaro or the equivalent Ozempic or similar for diabetics, it's often covered by insurance. The weight loss medications are rarely covered by insurance, in my mind, or in my experience, I should say. Mm-hmm. And then that cost can be like $1,000 out of pocket. There are compounded generic medications as well. And I do use some of those because the cost is about a third. Those are they are not FDA approved, but they're provided by state licensed pharmacy. And it provides some people that otherwise would not have access to these medications. It provides access for them.
So it sounds like there are three levels. So the official pharmaceutical brands, they're the compounded brands that if they're made by a trustworthy, legitimate pharmacy, they have the generic ingredients. But it's a little bit of a dodge because, it's kind of a gray zone legally because they're not supposed to do that. They're not supposed to take a drug that's under patent and offer it generically. So I'm not sure how sustainable that's going to be. And then there's the outright bootleg operations where you just don't know what you're going to get. And people have actually gotten sick and been hospitalized because there's no quality control on that. And, you pays your money and takes your chances.
Yeah, absolutely. But again, any of these should be used in the context of, working with a medical provider that is following you, preferably in my mind, seeing you monthly, having a health coach contact you at least once a week. So again, you can achieve both the outcome you need and not be dependent upon the medication indefinitely.
Is it fair to say that the patients who succeed on these weight loss medications are the patients who get religion when it comes to the right kind of diet, the right kind of exercise, maybe incorporating intermittent fasting so they limit their feeding window and time-wise, that it really entails not just the use of, a weekly injection, but a lifestyle change and an attitude change.
Yeah. And that's one reason I like the CGMs. As I mentioned, patients, the continuous glucose monitors to help guide this. And once people see the spikes and valleys on their CGMs, they get religion, just as you mentioned, and they convert to a sustainable lifestyle. And again, I'm a low carb person. Some of my patients go keto, not many of them. But I just think the low carb insulin resistance model is a lifestyle sustainable model as opposed to the calories in, calories out, energy balance model. because I just don't think people can restrict themselves like that for a lifetime. So really, this is a more doable plan. And when you combine, low carb with intermittent fasting and then make sure you're maintaining that muscle mass, maybe sprinkling in a little bit of the GLP-1 medicines, I think that's the best approach.
A key controversy about these low carb diets, especially keto diets, which involve, some saturated fat and cholesterol, animal protein, is that while patients lose weight and blood pressure improves and blood sugar improves, often their LDLs go up. And it is said that because of these surrogate markers that, they may lose weight, but they're subjecting themselves to cardiovascular risk. As a physician, you're aware of this controversy. What's your take on that?
So I'm just going to tell you, I think we put way too much emphasis on cholesterol and LDL. I think the statin agenda has pushed that over the course of the last 30 or 40 years. I think if you're serious about a high LDL, you need to not only look at the overall LDL number, but the subunit number, because the type of LDL you have can make a big difference. So for people that have an elevated cholesterol or LDL, which is the bad cholesterol, looking at whether, I don't want to oversimplify this, but basically there's big fluffy LDL and small or ping pong LDL. And the big fluffy ones contribute to the overall LDL number, but they really aren't damaging. And if you have predominantly that type of LDL, it's not an issue. But if you have a smaller type, like I happen to, then you need to be cognizant of it. But the other thing I see, like routinely in my patients, I see this over and over again, and sometimes it's remarkable. And it is the drop in triglycerides when
I
you
was
go
just
on
going to
a
mention
low
that
carb
you just anticipated my next question. Is as a marker of cardiovascular risk, how important is triglycerides, and what's the impact of these diets on triglycerides? And I'm sure you're about to tell me it's very, very positive.
Yeah, I've had conversations with lipidologists, lipid experts, and obviously they feel triglyceride is, a big issue. What happens is this is counterintuitive, but you think that if you eat more fat, well, that's going to raise the fat in your blood. But related to triglycerides, what happens is triglycerides are converted from blood glucose to fat in the liver. And that's actually how fatty liver occurs as well. So eating fat doesn't cause fatty liver. Eating too many carbs that raise your blood sugar, that cause that conversion from blood sugar to fat in the liver, is what causes it. So when you start cutting off the substrate or, lowering the fuel in that conversion process, when you get your blood sugar lower, then the triglycerides drop as well. And I've seen people's triglycerides drop from, 240 to 86. It's really remarkable. And of course, that plays into this, lipid risk factor issue as well.
And when it comes to a fatty liver, which is a problem so prevalent that perhaps the majority of adult Americans have some degree of liver impairment due to fatty liver, how do these low carb diets fare? And do you see an improvement in fatty liver that is associated with a reduction in the fluctuations in blood glucose?
Yeah. Low carb diets, are very effective at treating fatty liver disease for the reason that I just mentioned. Fatty liver disease is a problem. 1 in 5 American adults now has it. And you can monitor this through liver enzyme elevations, as you well know. And I've had a number of patients that we've been able to basically see that liver enzyme elevation, essentially decrease to normal values. And so, again, that's another, I think, beneficial effect of low carb diets.
So tell us a little bit about your practice. You're located out in the Midwest, I think. And do you see just local patients, or do you also do telemedicine for people all over the country? Because we have listeners all over the United States and Canada.
Yeah, COVID really kind of changed things. And so I do have an office in Ohio and Indiana, but 90% of my practice is telemedicine. I'm licensed in Ohio, Indiana, Florida, and Arizona. And we see, again, the majority of our patients by telemedicine. And for this type of practice, that works really well. It's not necessarily a lot of hands-on. It's really gathering data, discussing that data, and then putting a plan together that can be implemented via telehealth. I work with a team of health coaches. I have a nurse practitioner, a physician assistant working with me. And, the medicines came out, the GLP-1s have been popular for the last, couple years, but I've been doing metabolic health for about 7 years with really a focus on that foundation that we've talked about, using continuous glucose monitors, and the intermittent fasting and the strength training. And, I had lots of patients who lost lots of weight, improved their metabolic health tremendously. Their primary care doctors were able to de-prescribe medications. That's one of my favorite words, de-prescribe.
Yeah,
come
me
off
too.
your blood pressure. So, yeah. Come off your diabetes medicine. And so really, that's really the foundation of things, doing those things. If you're going to use the medicines that we've been talking about, it's, okay to use them in the manner we discussed, but make sure you're rolling up your sleeves and doing the other work you need to do so that you can change your lifestyle and you are not dependent upon medications long term.
So where do you think you're saving more lives? In the emergency room, doing heroic medicine, or as a metabolic physician?
It's amazing. People come in. The thing about emergency medicine that impressed me and moved me in this direction is that, and we reflect on this personally as well. It's like 1 minute, everything can be fine. And the next minute, everything changes. Whether that's a heart attack or a stroke, or you just heard you have kidney disease. And I like that acute intervention. As emergency physicians.
Yeah, I
really
love
only
it. I
interact
loved
with
blood and
patients.
guts medicine when I was going through my training. It's just exciting and adrenaline rush and gratifying when you can save a life. But they keep the same people keep coming back into the ER again and again.
Yeah, but and then in my practice, the satisfaction from it sounds trite, but you can change lives with this approach. People that lose 40, 50, 60 pounds, people that are pre-diabetic, that are no longer pre-diabetic. I've had young people and you just see the direction of their life changing. CGMs, when they get it, looking at their curves can be part of this. But they're going down a path that maybe their parents went down, being overweight, diabetic, and they turn on a dime. And they're never going to have that problem again because they've adapted a new lifestyle. And, I know you've experienced this, Ron, too. It just can be very, very satisfying.
Indeed it is. Okay, so the resource for our listeners to find out about Dr. Paul Kolodzik's practice, metabolicmds.com, and the same website, metabolicmds.com/free book, provides intelligent medicine listeners with a complimentary copy of Dr. Kolodzik's book, The Continuous Glucose Monitor Revolution for Non-Diabetics, which has a lot more detail on these very, very innovative devices and how they can be an important adjunct to real health transformation for a lot of people. So thanks very much, and congratulations on your work. I appreciate very much what you're doing.
It's been a pleasure. Thank you.
I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment, Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.